Hello, I'm Tony Chatfield and I'm the Head of Operations for Health Courier Services and Procurement Services. The Health Courier Service is the wheels of the NHS within Wales. Every day we visit more than 2,000 locations, either delivering or collecting items that are of a clinical nature to support the NHS in its day-to-day operations. Our services aren't always at the forefront of a patient's mind, yet every day within the NHS in Wales we will have had involvement in the care of every single individual patient, whether it be distribution of their prescription, collection of their pathology sample, or distribution of their medical records or GP records. Every day we visit sites that are managed by our partners within the NHS, whether it be health boards, ambulance services, or charities such as the Welsh Air Ambulance and Mae'r, the Emergency Medical Retrieval Service. You will see in this video that the innovation and technology we use every day helps support our capture of key performance indicators for our time in transit of items or where our vehicles may be at any point of the day.
My name is Gildas Griffiths and I am the Operational Services Manager for the Health Courier Service. The Health Courier Service in Wales supports frontline services. We operate 24 hours a day, 365 days a year, providing vital logistic services for hospitals, clinics, surgeries, GP practices, pharmacies and schools. We were recently asked if we can support the Wales Air Ambulance in providing logistical support for transporting air crew when the helicopter couldn't fly, for delivering blood products for emergency situations when the helicopter was running short, and that could even be extended to equipment that they were running short on, and also medication. One of the things that we've done recently is set up a schedule that allows the air ambulance to contact us at any given time within a 24-hour period, and we can provide urgent and blue light responses to any request that they make, which enables them to respond quicker and not have to be concerned about the logistical side of requiring urgent supplies.
My name is Mark Winter. I'm the Emergency Medical Retrieval Transfer Service Manager and also the Operational Lead for Wales Air Ambulance. So our relationship with Health Courier Services is vitally important. They provide to us the blood that we can take from blood bank and place on board the aircraft. We have a signing over process. We need to make sure these donations are looked after very, very carefully. And then when a call comes in and we decide that we're going to use our blood products, we take them to the scene and we utilise them. And more importantly then, we're thinking about how we backfill those arrangements, and then we're contacting courier services again in order to get fresh supplies back to the crew so they're ready for the next tasking when it comes in. Health Courier Services has grown over time, and I don't see it, and neither do my colleagues, just as a transport platform bringing bloods to and from the bases. They also ensure that we get our supplies, our medical equipment, and also, more importantly, our medications that we can then pass on to patients that we come into contact with. We've also got the emergency medical arrangements in terms of, in the event there's a major incident, we get massive support from our colleagues in this really important part of the NHS, who can now provide blue light provision in terms of taking either equipment to the scene, or indeed could also mobilise personnel as well if required. We've been together a long time in this relationship, and the arrangements that have been fostered is a real can-do attitude between the two organisations, and I'm very grateful for that.
Hello, I'm Avril Williams. I'm a phlebotomist at Lindra Cancer Care Centre. I'd just like to say a few things about the courier service that we have at this hospital. It's very good at the moment. It's improved a lot over the last year. They come every hour to take our samples over to the UHW or to Landoc. Seems to be working very well, and if we need anything from UHW or Landoc, they bring it to us, which is very good as well. I'd like to thank the Health Courier Service for the service they provide for us. It seems to be working as a team, well together. Just like to say thank you.
One of our latest innovation projects has been to develop a application on a telephone that we can share with all of our staff all over Wales, that allow them to access the same systems in a safe and secure manner, which allow staff to use our Cleric application, which is the system we use to plan and allocate our calls. Our staff can also access ESR via an app on a governed system that allow them to book annual leave. They can also access other facilities on the app that allow staff to use them consistently throughout Wales.
My name is Nick Kilberg, and I'm a manager down here at Health Courier Service at West Point. In the last 2 years, we've introduced a new software system for our drivers and the organisation here at West Point called Cleric, and that software allows us to track and monitor all the jobs that come into here. We put them onto the system, and the driver picks up the job and the work that he needs to do on a handheld PDA. And the Cleric system overall gives us an opportunity to meet and manage performance indicators, to invoice outside businesses that have used our service, and to keep a track on exactly where and when our drivers are arriving at certain places. It monitors every delivery we do, how long it's on the vehicle, whether or not we're behind schedule, and we can maximise the logistics by giving the right job to the right vehicle.
Everybody knows you cannot run a hospital without a porter. They deliver the food, the pharmaceuticals, the linen, every item involved in care of patients every day. Yet we do that between all of the sites to make sure those sites can operate. We're the wheels of the NHS and hashtag not just a courier service.